Good morning. Good morning. Welcome to the second Wellness Wednesday webinar from the First Nations Health Directors Association. I'd like to introduce myself. My name is Jennifer Jones. I'm a registered Liaxin member. Currently, I am the health manager for Semanis First Nation, and I serve as one of 3 regional board representatives for Vancouver Island, so just representing Coast Salish family. So I'd like to acknowledge that many of us are on different many traditional territories on which we are collectively gathered, and remind participants that we are recording this webinar for those who are unable to attend today. Today's topic is the Maternity and Babies Advice Line, which provides services to expectant mothers, new parents, guardians, and caregivers in rural and remote First Nations communities in BC. This advice line is a partnership between FNHDA and the Rural Coordination Centre of BC. Health directors play an important role in supporting young families, and the advice line offers advice and referrals to health professionals working with expectant and new parents. I am happy to welcome our presenter, Dr. Malhotra, FNHA's Women's Health Medical Director. And for the next hour or so, Dr. Malhotra will talk to us and talk about the advice line, how to access the advice line, information provided to healthcare providers. And I just want to acknowledge there'll be an opportunity to ask questions following the presentation, but we ask you to type the questions in the question box. And just to acknowledge Kimberly and our FNHAD team will be monitoring the box. So thank you, ladies, and thank you, team. So I'm very excited to learn more about this topic. So I'll hand it over to Dr. Malhotra. And if you could please take a moment to tell us about yourself before we get to the webinar. Thank you. Haishka, have a great session.
Thank you. What a pleasure it is to join you today. So I work in the Office of the Chief Medical Officer as the Women's Health Medical Director. So I work with a team within our other departments like wellness and nursing to attend to the needs, at times unmet needs, of our maternal child population. So our moms and babies and families in our communities. So it's sort of a broad scope of things we do. And I'm hoping to, throughout this presentation at the end in particular, go through some of the things that we do and answer maybe some pressing questions that you have on the topic. But today I wanted to take the opportunity to speak to you about MaBAL. I'm going to just start a slideshow here on the topic. Here we go. And I'm hoping that this works. So what's MaBAL? MaBAL is the maternity advice line for moms, babies, families, communities, for all things reproductive and sexual health, really. So prior to COVID, we knew that a lot of our communities had unanswered questions when it came to maternity care, feeding, breastfeeding, nourishment, delivery, post and pre-pregnancy care, all of these questions that everyone would have, but at times there is no reliable specialty provider available to answer those questions, especially not 24 hours a day. So we knew before this that this was a need. And then COVID hit, and it really highlighted the need when we're unable to leave our communities, when we're unable to see our practitioners on a regular basis, when it becomes even that more challenging to get care. It became very, very clear that this was something we needed to address ASAP. And so fortunately, at the time of COVID, I was able to connect with the Rural Coordinating Center, and we were able to put together this virtual service. So what we were hoping to target particularly is communities that have to travel for care or are already relying on care that isn't always available. We wanted this to be a bridge to ensure that some unmet needs are being met. So we came up with MaBAL, the Maternity and Baby Advice Line. Now, it's a wonderful service that I'm going to tell you a lot about, but please feel free to ask any questions along the way, of course. So the first thing I thought with my partnership is who's going to answer this phone line? So immediately it felt right to have people that work in primary care but specialize in obstetrics taking these calls, because that's a really broad scope of care. These are folks that work in communities. You may know some of them. They have experience in rural and remote communities and care. And we felt like they were the best experts to take on answering the calls. They're also used to late nights and they're used to 24-hour shifts. And so it worked really well for all parties. We're also bringing midwives into the stream because midwives offer, as you well know, an extensive array of knowledge that can really complement the service, particularly when it comes to feeding, really personal concerns. So we wanted to make sure that we included not just physicians, but midwives in the answering of these calls. And again, it might be some from your community that are answering the call. You go. Well, it's 24 hours a day, 365 days a year. It was really important for us to make it as accessible as possible. And since we know babies come at any time and baby concerns come at any time, it's really important to be able to access at any time, because we can't time when we have these questions. And we're thinking of a new nursing mom or a community in need that's far away from any other services that would think these things can be emergent. And so we wanted to make sure that we had a really wraparound service available to people. So how do you access it? This looks so complicated, but I promise it's not. We have two ways to access MaBAL, and this can be circulated after as well, as far as the best ways to access. So for the actual virtual service, it's like any other of the virtual services available already. So things like the emergency services and pediatric child services, anything along that line, it's the same. We have a Zoom link and address to access these services. And again, I'll send out a poster that has these sort of as shortcuts as options. But the Zoom link allows us to actually see what's happening with folks. So if you're having a feeding concern, we actually see you feeding. If you're having a concern about your baby, we can actually see that. If you're having some issues with a wound, we can see the wound. So if it's post-care or anything along that line, we can absolutely see it. Now, that being said, I recognize that not everybody has access to Zoom. And so we do also have a phone number, which I'll also circulate as well as needed. So who should call? Well, the one thing I do want to say is that if you think that it could possibly be related to something we could answer, please call. The best is just to call, because more than likely with the breadth of knowledge that our providers have, both our midwives and our family doctor obstetrics specialists, within what their breadth of knowledge is, they can more than likely offer you some assistance in some way, shape, or form with whatever the concern might be. But we do want calls related to pregnancy, after pregnancy, and with newborns. Now that can include pregnancy-related contraception. So after you've done having your baby and you'd like to talk about birth control following that, great time to call. Feeding, a big one. There's not a lot of feeding support available to really anyone in the province, but particularly once we leave any urban centers. And we wanted to make sure that that was something that was a really high priority in what we were offering. And so if there's any concerns about feeding, growth of baby, formula, breastfeeding, anything along that line, give us a shout. Bleeding at any point. So whether this is once one is pregnant, during pregnancy, after pregnancy, let us know if you're having any concerns about bleeding. Cramping, in particularly during pregnancy, if you have any cramping, that's a good one to call us for. Desired termination. So early pregnancy questions, family planning decisions, anything along that line, let us know. And then of course, complications. If you had a complicated delivery or a newborn, one great thing is that the virtual service in this way can be linked to even more virtual specialists. So if needed, a complicating factor that is outside of the scope of our providers, there is a providership agreement between the obstetrical program, so even more specialized than our doctors, and the pediatric neonatology newborn group. So the way we can answer your question one way or another. And again, if in doubt, just give us a call. So where are we headed with MaBAL? We hope to have a text version of MaBAL at some point. We do have a strong collaboration with the doctor of the day and the other specialty services that I just mentioned, and we hope to continue to expand and broaden and deepen those relationships so that we're really all, when you call one virtual service, if it's not within the scope, how do we facilitate making it as easy as possible for you? And making sure that you're speaking to the right provider, because there's so many of us available now. We are hoping to embark upon a strong relationship with PTT, which means transport. So we hope to look forward to having a strong bond with transport, because sometimes these can be emergent situations that they are required for. We also hope to be offering prenatal classes going forward. I know sometimes in communities, it can be very hard to have enough people to bring in someone to do prenatal classes, or the availability to even have someone to bring to do prenatal classes. And we're hoping that, particularly with our partnership with midwifery, that we can start to offer some educational outreach programs. SIMs are education within our own service, so for each other, where we do simulation services for each other to make sure that we're always at the top of our game. And that has begun, because we always want to be the experts on the call that you request, desire, and need. So we try to make sure that that's happening. And of course, we're looking towards, hopefully imminently, offering more service at home. So we're hoping to ensure that there's more reproductive health services where you don't have to leave community to access them. And that's where sometimes these types of services can come into play. And I think they're really important to loop in, because at times it can be out of scope of practice of nursing or a provider on site. And then potentially we could be linked in to assist with offering more services at home. So I always look at everything as a partnership, and everyone has great skills and collaborative abilities. And I'm just hoping that this will be something that we can all collaborate on. So we're here to support communities. We're here to join forces on what you might need for reproductive health. And we're hoping that you can help us get the word out. Now, for MaBAL, one thing that we do hope is that this is a community-driven piece. And what I mean by that is that at times folks need advocacy when it comes to reproductive health. And so anyone who can help facilitate the calls is really beneficial and helpful. And that means when someone needs the service, if in on-site in community nursing, healers, spiritual care, elders, anyone can be a part of that call to support the caller. We really appreciate that going forward. So I'm just going to break for a second and see if we have any questions related to what I've talked about so far before I pivot a little bit.
I don't see any questions in the question box so far. So a reminder to participants that in webinar mode, everyone is muted, but please feel free to put your questions in the box and we will get them to Dr. Malhotra. Go ahead.
Wonderful. Thank you. So MaBAL was something that was really created out of what we heard at the maternal child health team at FNHDA about service need and access. And so I'm really proud that it exists now, and I'm really hoping that it does help communities. But I also wanted to kind of touch upon some other things that we hear and work towards and are hoping to collaborate on going forward. So again, contraception is something that's something that we know very well as a team that requires more attention, particularly when leaving community, on accessing culturally safe contraception care. And so that's something that we're absolutely dedicated towards ensuring is the case. The same with sexually transmitted infections. So it's always a touchy topic, of course, for everybody when we talk about sexually transmitted infections, but we're trying to make it a safer, more culturally safe, more trauma-aware experience for people. So that's a piece of work that we work on extensively at in the maternal child health team. And then pregnancy. So pregnancy and MaBAL are intimately connected, of course. And something I just wanted to touch upon is that any of the providers on MaBAL have been in discussion with the maternal child health team at the First Nations Health Authority. And one of the important pieces to that is that we ensure that it's really patient-centered and that any service being provided to community really revolves around patient wishes. And why that's pointed during pregnancy is pregnancy such a vulnerable time. It's a time which has changed tremendously at the time of COVID. It's something that is so different as far as birth plans and appointments and leaving and coming from community and what that looks like, that we wanted to ensure that we had at least something that was stable for people. And that's just one piece of work that we have worked on sort of at Team Maternal Child Health at FNHA. And it's something that we're really dedicated to, ensuring that people have safe pregnancies in a way that they feel comfortable and have security and support offered to them, whether it be MaBAL or directly to us if needed. We're always available for any concerns, of course. But when we talk about pregnancy, it's a broad field, of course. We do work towards education on nutrition, support systems, availability of resources, healthy pregnancies, activity in pregnancy. And we also did a lot of work on pregnancy and COVID. And that is both provider facing and community facing. So for community, we tried to put out a number of posts that could really potentially and hopefully ease people's minds on the risks of COVID and pregnancy. Because we do know those risks are, of course, top of mind and of great concern to anyone that is pregnant at the time of a pandemic. So I urge you to take a peek at the FNHA blog posts that we have put out. And if you like, we can certainly send them directly. However, what we tried to touch upon was what's the best way to stay safe at COVID when you're pregnant? What are your risks? How do you now navigate and manage the system when you're pregnant? And those are all really, really important pieces. So at this current acute time, those are the pieces that we worked on with pregnancy. So that's on top of our work that I've mentioned related to feeding and information going out related to pregnancy. And then feeding, we do a lot of work on feeding, and my amazing colleague, Barb Webster in the OCNO, is a feeding expert. And so she herself puts out a ton of information on feeding, very valuable resources, and definitely in response to what's available in community, what communities are struggling with and what they aren't thriving with, and trying to sort of balance what we have to offer. But a lot of information. And I think it's all really, really valuable information. And then we do a lot of work on cancer screening. Now, in reproductive health, this is something sort of true to my heart and my work plan on a regular basis. And this is again to do with accessing culturally safe cancer screening and follow-up. Now, how that relates specifically to maternal child health is, of course, specific gender-based screening. So mammography, for example. I spend a lot of time with BC Cancer on ensuring that the materials that go out are appropriate for our communities. I ensure that you are heard. So if you have concerns, please let me know. We are partners with them on the mammogram bus, and we try to ensure that we have as much information going out before the bus approaches, and that we ensure that communities are being served by the services available. And then the other one is cervical cancer. So when we're talking about our moms or life givers, we talk a lot about cervical cancer. And the reason that we do that is to ensure that we start to minimize the gap. And what that gap is the number of women who attain cervical cancer in their lifetime is far higher in First Nations women than any other population. And there are lots of layers of reasons, primarily generational trauma, an inability to access trauma-aware, culturally safe care, and of course, the fear and layered fear of what will happen in these intimate procedures. And that is really, really important to me. We always have the goal in our minds of attaining exceptional care in a safe fashion. So one of the pieces that we work on is working towards self-screening. So there is a virus that causes cervical cancer that you may have heard of, HPV, that we do have prevention for. We do have a vaccine for it, but not everyone has had it. And so we rely on screening in many aspects of our care. And that screening is traditionally Pap screening. So a pelvic exam in a doctor's office or a nurse practitioner's office, and at times nursing. But with that, it can seem invasive and it can be something that folks would want to avoid. And so we're working on the expansion and support of self-screening, meaning that we can test for the virus ourselves, that women can actually take a test on their own safely, privately, and with no third party involved in a pelvic exam. And that's something that we really aim to move forward. Now, it's been piloted in a few of our communities, including my own. I'm calling in from the beautiful West Bank First Nation. And it's gone very, very well, and people have received it very, very well. And now I know that BC Cancer is moving forward with some of the results that we've had and our input on how to actually make this a reality in the future, which we're really hopeful will be sooner rather than later, because that is truly one piece of trauma-aware care. The other piece is that we work on with cervical cancer in particular is working with the follow-up pieces. So we've hopefully offered some prevention, a very safe vaccine that's been around now for almost 20 years, the Gardasil vaccine that kids get in school. And you can do a catch-up program if you're within a certain age group that does prevent most cervical cancers, and it is safe and it is reliable. And then we talk about screening and trying to make that more safe. And then say the screening needs follow-up. We're working towards more culturally safe follow-up as well, so that I recognize upon receipt of a letter that you require follow-up from your PAP. That's scary. And it's absolutely something that would absolutely concern someone and potentially maybe not want to attend the follow-up appointment, or if going, would feel quite nervous about going. And I can completely relate to that. And so what we're trying to do is ensure that not only when you go for the follow-up of this screening, you know why you're going, you know the communication has been heralded, that you feel comfortable with the communication that's been provided to you, and that you feel ready from that perspective. And so we're working readily with BC Cancer on this, as well as the specialists in that field who are called colposcopists. So even just defining who that is and what a colposcopist is, I think is very, very important. But we're doing education towards providers to ensure that their spaces remain safe. And we're doing education with the materials that are sent out to ensure that those are also things that one can read and understand and know who to contact if there are questions and concerns and what that would look like. So a lot of work in the cancer realm with the Matt Child team. And then another piece of our work is advocacy. So at times, things in community can occur, as we all know, and sometimes those concerns need to be escalated. And at times they come to us at the Office of the Chief Nursing and Chief Medical Offices. And we are happy to help and support. And I just want to ensure that it is well known that we are your partners and we are in collaboration with you, and your voices are of the utmost importance to us. So when there are concerns, please tell us, please let us know, please ensure that we have resources and abilities to potentially help. We all have different skills among all of us in this collaboration, and we can more than likely bring those skills together and offer a great deal of support. So that's our hope. And then one piece of work that we do in the maternal child health team, of course, is the other side, the newborns and the children. And so we do have a specialist in this area on our team who does a tremendous amount of work that we should be very, very proud of and are very, very proud of. And so within that work, the wonderful Denise Lessert leads that work in our team and does really amazing work as far as related to Head Start programs and supplemental programs on top of that, and supplemental access on top of that. And so a lot of work going towards child care, as well as newborn care. We again try to provide, we hope, helpful and useful pieces of information. And now specifically to the time of COVID, we did put out a number of materials again related to health of children, mental health and wellness, physical health and wellness at the time of COVID. And really supporting communities, yourselves, the families, the children, to really hopefully take into account that this is an extremely stressful and difficult time. And it can at times need some support. And we really truly hope to offer that in one way or another. So again, just letting you know that we're here to collaborate and support. We all have varying skills, and I'm sure we can all put our heads together and figure things out. Just miss you. Thank you. Okay. Now, although there's no more slides, I did want to talk a little bit more about where we're at with COVID and the maternal child perspective on vaccines. So one thing that I wanted to just read is a consensus statement. So the statement of all of the folks that are involved in immunization have come together and put together some information. And I'm actually just going to read it from the Society of Obstetricians and Gynecologists site, and then talk from there. The Society of Obstetricians and Gynecologists is a national body who is generally represented by experts in every part of the field of maternal child medicine. So in this specific circumstance, in this specific time, the experts that came together are all people with extensive experience in infectious diseases and pregnancy and newborn health. And so when the statements first began to come out as far as what to do as far as vaccine in pregnancy, more information really needed to be gathered to decide where to land. So it became kind of confusing, not just for community, but for us too as providers, as we truly didn't entirely know where this would land. But as information has come out and as cases have been studied and global data, local data, regional data has all been reviewed, the following statement has come out, and I think it's a wonderful statement, where we say women who are pregnant or breastfeeding should be offered vaccination at any time if they are eligible and no contraindications exist. This decision is based on the women's personal values and an understanding that the risk of infection and or morbidity from COVID outweighs the theorized and undescribed risk of being vaccinated during pregnancy or while breastfeeding. Women should not be precluded from vaccination based on pregnancy status or breastfeeding. So what does that all mean? Well, it means that what we learned over time with COVID, which really in the realm of medicine is not a lot of time, is that what we know, yes, not a lot of pregnant women have gotten COVID during their pregnancies. Some have, including in British Columbia. But the risk of them becoming very sick with COVID is higher than the risk of obtaining the vaccine or any thoughtful risk towards getting the vaccine in pregnancy. So to protect pregnant women and new moms, breastfeeding moms from the very, very concerning effects of COVID, which seem to be very severe in pregnancy, it is really best to offer the vaccine at this time and offer it really inclusively to ensure that, yes, we have reviewed safety data. Our experts in infectious disease and obstetrics, so a combo expertise, have reviewed the vaccination safety for pregnant and breastfeeding moms and have come to the conclusion that it is very important to have a very open discussion with whomever wishes to have the vaccine in pregnancy and really let folks know that it is important vaccine to get in pregnancy, because we really always have to weigh it. What is the disease burden versus the vaccine concerns? And of course, it seems like a new vaccine, but the makeup of the vaccine, the composition of the vaccine, the result of the vaccine is not new. We were able to use technologies that we've known for quite some time to create something rather quickly based on already known and used components, science, and data. And so when we talk about a vulnerable population, about like pregnant women, we are taking all that data to say it is an important vaccine in pregnancy. It is important for mom, it is important for the babe being carried, it is important for the new family. And it really, really does offer a good amount of protection. Because our fear really is, of course, that pregnant moms will obtain COVID and will get very, very sick. And we just don't want that to happen. So we want to prevent that if at all possible. So I'm wondering if anyone has any questions regarding that piece.
Hi. I only just seen one question that came up. It came up earlier, so sorry to backtrack a little bit here. Is sort of around, I think it was, we were talking about culturally sensitive care and the concern sort of raised around hospital visits and culturally safe care in hospital. And I guess what MaBAL could offer in terms of supporting pregnant or birthing moms or parents in that setting.
Mm-hmm. Absolutely. The concern regarding culturally safe care in the hospital is one that we have at a high priority on our minds at all time. I know it is daunting to enter a hospital. It is daunting to think of how one might be treated when one gets there. And we hear you and we feel you. Now, one of the reasons MaBAL is available is because some things that you may have thought should go to the hospital, you could call MaBAL first and see if they need to be seen in a hospital. It could absolutely be used as a triaging service in that respect, because sometimes it might not need to go to the hospital. Now, it might, so please seek care. But there might be things that could be troubleshooted by providers who understand your circumstances and understand what you're going through and have the same objective of providing safe care, and who really want to hear your voice and ensure that you're heard. And when we think about the basis of care in maternal child health within our team, what we try to express to anyone working with us is that families and communities are the center of their care. And every touch point that is touched upon within care is impactful and needs to be safe. Every single piece, from answering a phone to a document to a form to whatever it might be, to a surgeon, like every extensive piece of the care. And so we are fortunate to be able to say that is the kind of care that MaBAL is offering. So it's providers that have experience in communities and at times live in them. And so I think that that's an important piece, but we recognize it and it translates to other work we do. I know I've talked quite a bit about cancer screening. A big part of someone not wanting to follow up with cancer screening or get it is absolutely the concern about what kind of care will be received and treatment that will be potentially put upon someone. That we are trying our very, very best to combat and ensure that these don't have to be concerns going forward, that we don't have to put these backup plans in place. But please, if you have a concern and you think it could be maternal child health related, call MaBAL and see, and they will direct you to a hospital if need be. But with that direction, they'll also equip you with advocacy. So one piece that we've done on MaBAL too is that if you feel comfortable with the MaBAL provider and you end up going to another provider in person, we can be a part of that. That's the beauty of virtual care, that you can bring us into that conversation as well, that our providers will happily work with another provider and try to offer some advocacy as well and offer a safe space that goes along with you as well. So that's kind of nice about sort of a positive unintended consequence of this time where we've been able to set this up and have that as a communication bridge as well. And that's why it's sometimes nice that we have a third party on these calls as well from community there might be intricacies with the community that are special to that community that the person answering the phone would need to know and want to know. And that can be expressed. And then you also have an extra advocate as well. So yes, absolutely. A big part of the work that we're trying to do with MaBAL is advocacy and support within the system and navigation of the system. So thank you.
Thank you, Dr. Malhotra. And just following with a comment in chat, we will be, as we mentioned, we've recorded this. So this webinar will be available to all of you on the call and to the health directors who weren't able to make it. And definitely the links, we will be sending out an e-blast with more information, and the Dr. Malhotra mentioned the Zoom link and then also the telephone. So all of the ways to get in touch with MaBAL, we will make sure that we put that out there. And little plug for us, as always, if you do have questions out there in Health Director land, you can always email us at FNHDA@fnha.ca, and we are more than happy to source out that information and send it to you too. So, yeah.
Thank you. And just to say again that we all have different skills on this call. There will be so many wonderful skills brought to the table. And if there's anything in my skill set that can be helpful, please let me know. That's what I'm here for. If you have any questions or concerns, let me know. But yeah, we're really hoping to ensure that we're collaborating and that we can offer you our services and skills and share with you the work that we really are trying to move forward to ensure better care for your communities, that we as a whole wish to be the case for all communities. So if there's something that we are missing or that you feel is of vital importance, please let us know. But I wanted to just ensure that you had an idea of what we were doing and some of the work that we're working on. This is not a complete vision, but it's a good idea of some of the work that we do. So yeah, so happy to help at any time.
Awesome, thank you. I don't see any other questions. We have we either have a particularly quiet group, or you have done, well, and you have also done a particularly awesome job of laying all this out to us. So I'm just going to, I'm just keeping an eye open here. I don't see any more questions. So without any of those, then we can ask maybe Jennifer to come back on. And unless you had anything else you wanted to add, Dr. Malhotra, then we can move on to closing. And yes, absolutely, we will send out more information and the links, and the webinar will be available once we've had a chance to get it all uploaded. So
Thank you. Yeah, just a reminder that call MaBAL even if you don't think it's right for MaBAL. We'll probably be able to steer you in the right direction, and we are 24/7. So anything related to sexual and reproductive health for sure falls within our wheelhouse, and we're here for you. So, yeah.
Well, thank you, Dr. Malhotra. Again, I'd like to acknowledge the great presentation you've given us and some really good information, just acknowledging the primary care professionals working in obstetrics who are the best experts. And I just want to acknowledge you provided so much more information, including the vaccine deliveries for people that are during their pregnancy. That was great information. And again, acknowledging the pregnancy, the cancer, and the advocacy for our newborns and children. So just acknowledging that. On behalf of the FNHD, I'd like to extend our thanks to Dr. Malhotra for taking this time to share and bring us together today. Thank you to our FNHDA team participation. Without you, we could not do this, and I just want to really acknowledge the team. And again, I'd like to thank you for joining us in this presentation, all of our health directors in the province of BC. And I just want to make sure that you reach out, and if you have any more questions, and just to acknowledge, we're going to encourage you to bring out your inner artist or with Catherine John guiding us to create a beautiful painting. Thank you and enjoy your day.